So our next speaker, once again, amazing speaker. She's sitting right here in front of me. She will jump on the stage pretty soon. Excellent. Thank you. Thank you.
I'll jump up now.
Thank you very much.
Here.
There she is. All right, Susan Little. So, you know, the first thing Susan told me when I saw her, I said, "Hi, Susan, how are you doing?" She said, "I don't see any cats." I don't see any cats. And I'm like, okay, great. And how are you doing? You know, I really would appreciate to show some cats. I'm like, okay, never mind, Susan, that's fine. And then she told me something really funny. She's an amazing speaker. She has been the cat lady for years now, and she is everywhere in the world. She's so famous. And if there's an expert in cats, she is it. So we're really lucky to have her here. And she told me, you know, that last time, that because she tends to speak a little bit too long, and when she speaks too long, at one time, someone just turned off the microphone. Just like that. Unplugged the microphone. And I'm looking so much forward to that. So this is the first lecture. I'm looking forward to the end. Susan Little.
Thank you. Clearly, I'm going to regret having told Yola that story. Be careful what stories you tell. Thank you very much, Yola, for the kind introduction, and to Hills for inviting me to be here today with you all. I'm glad to see so many Canadians in the group. Aren't we just happy to be in Miami, Canadians, aren't we? I still have snow in my front yard, so I'm just happy to be here, period. And I am happy that there's cats up. I walked in the room this morning and I said to Yola, if there's no cats, I'm leaving. You know, there's got to be cats today. So we have cats, so that's great. Yesterday was a great day. Even as a cat vet, I learned some things yesterday. Even though there was too much of the D word, that was okay. I still learned some things. I learned one really important thing, and that is I need a DJ every time I lecture. Don't you think? Isn't that cool? Yeah. Okay, so today I get to talk to you about a topic that is near and dear to my heart, and you will see why as we go through this morning. And as a cat specialist, sometimes this feels like every day to me, fat cats who pee on the floor. You know, that's welcome to my life. That's what I deal with a lot. And any of you who see any amount of cats in your practice, I know that the same thing is your experience as well. So it's a very timely topic for us. So we're going to spend the next little bit looking at some data on prevalence and risk factors for both of these conditions in cats. And we'll look at where is the common ground, where do these conditions overlap, a little bit in their risk factors, but also in treatment strategies because they occur so commonly. How can we build some common treatment strategies for these diseases? And I think this is really where we're going in terms of treating a lot of these chronic diseases, particularly in feline medicine. We're starting to look at these combined treatment strategies, so we'll talk a little bit more about that as well. So I wanted to start with talking about a little bit about this cat first. So this is Lily. And Lily's problem is that her owner was finding urine on the floor near the litter box, and you can see from the photo that there's a towel under the litter box. And the reason is, of course, to catch the urine. And look at Lily. Look at how acrobatic she is. She's got like all 4 feet perched on the very edge of that litter box. She's like finely balanced there to pee, okay? And so one of the things that I'm going to reinforce for you as we go through this today is the value of getting pictures from your clients about what's going on in their home. This is how we figured out Lily's problem. So my first poll question for you is, why is Lily doing this? Why is she perched on the edge of her litter box? Is her litter box too small? Is it because it's the wrong type of litter? Or is it because there's too much litter in the box? What's the answer? So let's see what you think. So far, nothing. Okay. Off to a great start. People are saying it's not in their little app. Okay. Yeah, it is? Okay, we'll give it another second and see if it starts to pop up there. Okay, apparently you are voting. Oh, wait now. Maybe we'll refresh. We'll get there. Okay. We'll move on. Hopefully it'll work for the next one. Okay, what's the answer? Too small. Oh, you guys are so smart. Okay, so actually, it could have been any one of those, really. You know, I'm kind of being unfair to you and saying, you know, which is it, because you need more history than that. But as it turns out in Lily's case, yes, it was because the litter box was too small. And it did take initially getting a photo of her doing that. And so here's my first confession for you. You're going to hear a couple confessions from me this morning. Lily's my cat, and that's my house. Okay, so I have made the same mistakes that all of your clients make, and hopefully I've learned something from them. Poor Lily, as soon as I walked into the bathroom one day and saw her doing that, and I thought, oh gosh, that's why there's urine, like, because she's really acrobatic and her aim is good most of the time, you know, but some of the time she doesn't get it in the box. But then the poor cat had to suffer for 3 weeks while I'm stalking her in the bathroom with my camera to get that shot, right, so that I can show you. But I assure you, we did give her a real litter box after that, and now all is well in my house. So, value of getting pictures to find out what's going wrong. I've had clients who set up webcams and they spy on their cats, right, around the litter box to see what's going wrong. Okay, so a little bit about the prevalence of lower urinary tract disease in cats. I just showed you 3 studies here that were published within the last sort of 10 to 15 years to give us a rough idea of how common lower urinary tract disease is. There's a UK study there, a couple of US studies. And so one caveat I'll give you is these studies are not standardized. The data is collected in different ways. Some are retrospective, some are prospective. They use different disease definitions. But with those caveats in mind, prevalence is pretty consistent when we look at these studies in various countries. And you might say, you know, like 3%, that's not such a big deal. But in feline medicine, a disease that is present in 3% of the cats that come into veterinary clinics qualifies as a common disease. So a lot of other common diseases that you and I deal with are at prevalence rates of like 1.5%, 2%, 2.5%. So that qualifies as a very common disease. And as you can see in some studies, even higher prevalence than that. So I think there's no question that this is a common clinical problem that you and I deal with. And another way of looking at it is looking at insurance databases. So in the U.S., if we look at the largest veterinary insurance company and look at their database, it is the #1 reason that claims go into this pet insurance company for cats. And in Sweden, where the dog and cat population is highly insured, much more highly insured than it is in North America, they're able to publish some amazing statistics on morbidity and mortality and longevity of pets in Sweden. It's the #3 reason why cats have claims submitted to the largest veterinary insurance company in Sweden. So no matter how you look at it, this is a common clinical problem for us. So always remember that lower urinary tract disease is very much an umbrella term, and under that fall the more specific diagnoses. So when we say lower urinary tract disease in these studies, we're talking about anything that causes plaquuria, you know, dysuria, hematuria. And if we start to break those out, so this is a study that you see quoted a lot. It's from Tony Buffington's group at Ohio State, published in the late 1990s. This picture really has not changed since the late 1990s, where the #1 diagnosis for cats with lower urinary tract signs is idiopathic cystitis. So in North America, about 2/3 of your patients will have that diagnosis. Second most common is uroliths. About 20% or so of cats in that study had uroliths. But is North America representative of the rest of the world? We have an international audience. Not a lot of data from other countries, but this study was published not that long ago in the Journal of Small Animal Practice, and looked at a group of cats with lower urinary tract signs. And again, idiopathic cystitis was the #1 reason. Over half of the cats in that study as well ended up with a diagnosis of idiopathic cystitis. #2 in that study was also uroliths. So no matter probably where we look at cats with lower urinary tract disease, we will find idiopathic cystitis and then uroliths as our top 2 diagnoses. So what about risk factors for lower urinary tract disease? Most of the studies group all of the lower urinary tract diseases together, so you kind of get a generic set of risk factors. And they are things like being indoors and inactive, being obese, so here's where we start to tie in our obesity issues with lower urinary tract disease. One is a risk factor for the other. Cats are typically spayed or neutered. diet is a big question mark. Studies are all over the place in terms of the influence of diet, and by that I mean not so much brands, but I mean is there an influence whether you're on all dry or all canned formulations, for example. And most cats are young to middle-aged at the time of diagnosis. It's unusual for a senior cat to have a lower urinary tract diagnosis for the first time. They may have been diagnosed when they were younger and still have problems, but it's unusual as a new diagnosis in that age group. So pretty common risk factors, again, across studies, no matter which one you look at. So for all of the conditions that fall under that lower urinary tract disease umbrella, we can break out idiopathic cystitis. That is the one where we do have the most specific data on. And again, you see the indoors, the inactive, the obese cats come up as well at higher risk. Here's where male cats seem to be at higher risk for reasons that I don't particularly understand. It doesn't mean female cats can't get this, because they do. But male cats seem to be predisposed. And then we do start to see some other specific risk factors come in, mainly built around stressors. So multi-cat homes, particularly where there's conflict, where cats don't get along, which seems to be almost like most multi-cat homes. There's going to be some type of stress going on amongst the cats. Diet, again, question mark. Certainly dry versus canned, but there are some studies that point to low water intake as a potential risk factor when it comes to idiopathic cystitis. So starts to paint a picture about who is the patient that's going to be at high risk for these clinical conditions. So this is Tigger and Tigger's owner, and I like Susan's introductory remarks because she talked about the human-animal bond and the distress and the pain that this causes, and I think we always need to keep that top of mind. So certainly for lower urinary tract disease and idiopathic cystitis in particular, painful disease, very distressing for the cat. It's distressing for owners. They don't like to see this. It's costly for the owner. It certainly impairs the human-animal bond. So there's no question that this is a disease with big impact, not just in time and in money, but in terms of the detrimental effect it has on the human-animal bond. And to me, this is very much a welfare issue. So this is some North American data looking at the top 10 reasons cats get relinquished to shelters. And as you might guess, number one on there is too many cats. I own too many cats. And there's other common things on there, like I've got allergies, or I've got to move, or my landlord doesn't like cats, or my cat had kittens. But number 7 on that list is house soiling. And so we heard yesterday, too, that behavior problems tend to be the number one reason why dogs and cats end up in shelters. Right? So behavior problems should not be a reason why you lose your home and why you're in danger of losing your life. So for me, this is also a big welfare issue. What's the scientific term for house soiling with urine? What's the scientific term for that? Periuria, right? I love that word. Periuria. I only discovered that word a few years ago. Doesn't it sound much more intelligent when you say to an owner, Mrs. Smith, Tigger has periuria? Doesn't that sound better than he pees on the floor? I sound so smart. When I discovered that word, I felt so smart. Periuria. Hold on to that word. That's a good word. Yeah, okay. So, this is Poodle. This is Poodle. Now, I want you to be honest. We're switching gears and talking about obesity here. I want you to be honest. How many of you currently have or had a cat who looks like Poodle? Be honest. Be honest. Yeah, okay, come on, be honest. Okay, every time I ask this question, most people in the room put up their hands. Okay, here's confession number 2. My name is Susan. I own a fat cat. Poodle's my cat. I'm bearing it all for you today. No holds barred. Poodle's my cat. And I didn't name him. The kids named him. Cat that owns a cat named Poodle. I mean, really. So this is why it is personal to me. Poodle didn't get that way by himself. I certainly enabled Poodle to get that way. Right? I'm his enabler. I learned a lot about a lot of things in feline medicine through my own cats. And so you'll see in a minute even more why obesity in cats is particularly a personal condition for me. So here's my poll question number 2 for you. Of those 4 countries, which country has by current estimates, the highest percentage of fat cats? Is it the United States? Don't look at that question. That's the wrong question. The question is on the side of the screens here. Oh, Yola's trying to hand it over to me. Is it coming up there? Okay, here you go, Yola. You can have your phone back before I steal it. So, is it the U.S., is it France, or is it New Zealand, or is it the U.K.? Wow, I think we have kind of a consensus here. Wow. Gee, okay. Well, so more than 100 of you have voted now, and I'm going to tell you that you're going to be surprised at the answer. You're going to be surprised at the answer. It's not what you think. Okay? It's not what you think. The answer is New Zealand. By current estimates, the answer is New Zealand. Okay, now the United States is not far behind. Fat cats certainly live everywhere. Okay, they are everywhere. So in many countries, the prevalence of overweight cats is over 25%. But look at New Zealand. Most recent study in New Zealand, 63%. U.S. not far behind at 58%. France at 27%. And here's the country that seems to be doing the best, at least recently, and that's the U.K. at 11.5%. So it's not always what you think, although regardless, most of these countries have a pretty high prevalence of overweight and obesity. So here's New Zealand's Tubby Tabby's data. So current population estimates in New Zealand, there's 1.4 million cats. You do the math, that means we probably have close to 900,000 fat cats in New Zealand. And this is a trend. It's no joke to say that obesity is a growing problem. In New Zealand about 20 years ago, a 1993 survey found just over a quarter of cats were overweight or obese, and here we fast forward to 2012 and it's up to 63%. So a huge increase, pun intended, with growth in obesity. And we see that in other countries too. Here's the U.S. data. So 58% currently. That's based on the last survey that the National Pet Obesity Awareness Survey that the Association for the Prevention of Obesity in Pets, Ernie Ward's group, does. They do a survey every October, and they publish the data. So this is from October of 2014. And again, if we go back about 25 years, roughly, a survey done at that time suggested 35% of the cat population was overweight or obese. So it's hugely growing. And if we take current estimates, about 95 million cats in the U.S., that means we've got 55 million overweight cats. And so I did some math, simple math, because I'm not good at math. But if you do make a few basic assumptions, that means, wait for it, there's 135 million excess cat pounds. 135 million extra pounds of cat, right? And since we entered the room this morning, there's probably 10 more, right? And that is equivalent to about, I don't know, if your average cat's 10 pounds, that's 13 million sort of extra cats out there in cat flesh hanging around, okay? It's a huge problem. It is a huge problem. And unfortunately for you and I, for the pet population, in most countries we see this dramatic increase in the last 20 years. And that's multifactorial. Obviously, there's a lot of reasons why that occurs. But here is something that I want you to remember, and that's the fat gap. The fat gap. The gap between reality and perception. The fat gap. So the truth is that 1 in 5 cat owners, only 1 in 5 cat owners believe their cat is overweight or obese. 4 in 5 cat owners think their cat is perfectly fine. He's a little big boned, right? Maybe he's even thin. He's a little too thin. You know, his breed should be bigger, right? 1 in 5 cat owners actually know their cat is overweight or obese. But of course, the reality is 3 in 5 cats are overweight or obese. So why does that matter? It matters because if the owner is not on the same page as you, if you recognize the overweight or obesity in that pet and the owner does not, you're at 2 different starting points, and it'll be difficult to get compliance with that owner. So one of the things that I try to do when I'm working with these owners and we first diagnose, and overweight or obesity should be a diagnosis that's noted in the medical record. Okay, you and I are good at weighing animals and putting weight in the medical record, but we're not good at saying, okay, that cat is fat and that's a diagnosis. I'm going to flag that as a problem or flag that as a diagnosis. So it is a diagnosis. Once we make that diagnosis, I try to figure out where is the owner in their perception of this. So one of the things that I'll do is I'll ask the owner what they think their cat's weight is before I weigh the cat. Most people don't know what their cat weighs, and when they guess, they tend to underestimate. Okay? Except if there's like if they bring a kid, you know, like a 6 or 7-year-old kid, that's a lot of fun. Ask the kid, what do you think Tiger weighs? The kid will go, 40 pounds. The kid is usually closer to the truth. I'm serious. The kid is usually closer to the truth than the mom or dad is. Okay? So little things like that. I like to play games in the exam room, but they're instructive. So that's one. And the other is to ask owners to pick their cat's silhouette from the body condition score table before you do it. Just see where they are. That's part of assessing their readiness for change. How ready are they to commit to the changes that they're going to need to make? Because for the owner, this is a lifestyle change. You're asking them to make a lifestyle change is what you're asking. And that's tough. So learn to assess your owner's readiness for change so that you don't butt heads with them and you're on the same page. Sadly, this is one of my patients that we took a picture of recently. This is my daily life, fat cats. So risk factors for obesity, most of these will not be of surprise to you. More likely to be a male cat than a female. Male cats put on body fat more easily than female cats, usually spayed or neutered. Indoors, inactive. You know, again, we have the overlap with the lower urinary tract signs. Premium food. We certainly have an explosion of these boutique and premium food brands on the market in recent years. A lot of them are very high in calories. We'll talk a little bit more about genetics in a minute for these kitties. So back to Poodle. So that picture was taken of Poodle in July of 2002. And so here's why this is of particular interest to me. Here's Poodle 5 years later, when he's suffering from, no, don't clap your hands. Don't clap your hands. Why does Poodle look like that? He has diabetes. Yeah, okay, yes. Poodle now has diabetes. This is why this is personal to me. So he lost weight for the wrong reasons, and he struggled with diabetes. So I learned firsthand the cost as a pet owner, not just in dollars, but in watching your pet suffer with some of these diseases. And, you know, the best way for you to get your clients on board is to tell them stories. Tell them stories. We heard this yesterday talking about social media, that telling stories is important. And I'll tell owners the story of my cat. I'll show them those photos. A lot of what I show you in my lectures, I show to owners. The more stories they hear, the easier it is for them to understand. If you make something personal, you get more buy-in than if it's abstract, right? So a risk of diabetes of whatever % you want to put on it is abstract. But if you say, my cat got diabetes, or my technician's cat, you know, or you can talk with permission about clients' cats. So telling stories is a good way to get owners to understand risks and get buy-in for compliance. So there are lots of associated diseases that go with obesity other than diabetes. Some of these are direct cause and effect. Others are more epidemiologically linked. So dental disease, more common, for example, hepatic lipidosis, direct effect of being overweight. We see more lameness. We heard yesterday how dogs that are of normal body weight do better when they develop osteoarthritis. They have less clinical signs and they do better than dogs that are overweight or obese. Higher risk of infection, non-allergic skin diseases. And don't assume owners know this. They don't necessarily know this. And that's why telling them stories about the consequences of obesity in their pet is, I think, really important. Okay, so here is my next question for you. In a year in the U.S., how much do owners or how much do insurance companies spend on obesity-related claims? This is dog and cat together. What's the cost of obesity in a year in the U.S. for dog and cat insurance claims? Hopefully we can move on to our next polling slide there in a sec. Here we go. Let's see what you think. How much is spent on obesity? Okay, so we've got 52 million, 25.6, 2.3. You see, I picked nice round numbers. Okay, so the majority opinion there seems to be leaning towards 25 million, which is a big enough number in and of itself, right? But the correct answer is actually We can move on here to the next slide. 52 million. 52 million a year is spent on obesity-related claims, and that's just through that's one insurance company, the largest insurer, pet insurance company in the U.S., pays out $52 million a year. Think if that was spent on preventive health care. Think of that money, even if half of that money was redirected to preventive health care, so our dogs and cats did not get overweight or obese in the first place. Think of the value of redirecting that. That's what that says to me. How wonderful would it be if we did a better job at preventive care, explaining the value of preventive care to owners and redirected that money, what an impact that would have. So it is a huge financial cost. Okay, so I've been telling you a lot of numbers, a lot of statistics, a lot of epidemiologic data. So now really what we have to do is move beyond that and talk in the practical sense about how do we connect up all of these dots, all of the studies, all the epidemiology, and how do we connect these up in the cat, and how do we talk about managing these two common diseases? Where do they overlap, and where do we have some common treatment strategies in our feline patients? So when I was thinking about this, getting ready for this talk, I thought really this kind of falls into three broad categories when I look at these two diseases. And so we'll talk a little bit about the environmental component, because that's important for both of these diseases. We'll talk about the role of the individual cat susceptibility, and we'll talk a little bit about the nutritional aspect of this as well. That's kind of where it fell out for me. How many of you have a hospital cat or a clinic cat? How many of you have one? Oh, a lot of you. Cool. Well, this is Emil. And Emil, where's Alexandra? There he is, Alexandra. I did have a picture of him for you. So Emil was our clinic cat for a very long time, and we got Emil, as probably many of you get your clinic cats, because he lost his home. He had a disease his owner couldn't treat. Isn't that how you get cats, right? You don't get perfect cats, right? That's not who lives in your clinic. You get the cat somebody doesn't want, or he doesn't have a home, or he's got a disease, or you had to fix him. We get fixer-uppers, right, as clinic pets. Well, that was Emil. So we got Emil because he had idiopathic cystitis. He lived in a home where owner couldn't cope with that, and he was also overweight. And so Emil's problems were really environmentally driven. So he came to live with us, and you would think coming to live in a cat clinic, how stressful is that, right, for a cat who has idiopathic cystitis? I certainly had my doubts about how well Emil would do, but it turned out to be just the best thing for him. He loved living in a cat clinic. Like, who knew? A stressed-out cat would love living in a cat clinic. But he had an enriched environment. Look there, you can see we've got a little cat tree for him in front of the front window. Here he is at the front desk on duty in the morning with his cup of coffee. He's ready to take phone calls. You know, he got like right into, he's my best employee, that cat. He got right into things. Emil, in this environment, Emil had control over his surroundings. He had an enriched environment. He had people who understood him. And I started with Lily because Lily had an owner, me, at that time, who did not understand her needs. That's a really key component to treating these diseases, an educated owner. So Emil came to live in a place where the environment was much better for him. We know that stressful environments are a key to cats with idiopathic cystitis. We also know that stressed cats are less active, they play less, they have less exploratory behavior. It inhibits all of their normal behaviors, so they become inactive, and that's a risk factor for obesity. Right? So these things all start to tie together when you start to think about them. So once Emil had his new environment, his idiopathic cystitis came under control with diet and his new environment, and his weight normalized. So Emil actually did very well, and that was environment, I think, was key to treating both of his problems. What about genetics? So these are 3 of my patients. They're from a family of 5. I couldn't fit all 5 in the photo. Only 3 would fit in the photo. It was a mother and 4 kittens. They all look exactly the same. 4 of them are black and 1 is gray. Don't they look exact? And they all had names beginning with D. Don't you hate that? So I could never remember which name went with which cat, right? The names aren't distinctive. The cats all look the same. Isn't that just a nightmare when you can't, yeah, you know? Or here's my other nightmare. The owner and the pet both have a human name, like the owner's Frank and the cat's Joe. Is it just me? You know, don't you not mess and you call the cat Frank instead of Joe? Anyway, so these guys all had names beginning with D, and they all looked exactly the same, you know, and they were all female. Like, oh, gosh, it was horrible. But those cats all died in less than 10 years from obesity-related diseases. All of them. Now, of course, they lived in the same environment, they had the same owner, but it's cases like that that make me wonder, is indeed there a genetic component? And there is some research underway right now at the University of Zurich looking for major gene markers for obesity in cats to determine which cats have high risk. So here's what I dream about. I don't know what you dream about at night, but here's what I dream about. I dream about the day when we have an easy genetic test for cats, for kittens, to determine who's at high risk of obesity. Like, if you could do a cheek swab, very CSI, right? Do a cheek swab, send it off to the lab, and the lab sends you back a report and lets you know if that kitten is at high risk of obesity. I think that would focus our attention as a veterinary team on that patient and preventing obesity, and it would underline for the owner the importance for that kitten of preventing obesity, so we prevent obesity-related diseases. So this is that's on my wish list. I want to see that before I die, that we have a way to screen kittens to determine if they're at higher risk, the highest risk category. So that's where I think genetics will be useful to us. In idiopathic cystitis, of course, we do know that we have many cats that seem to be uniquely susceptible to this disease. Lots of wonderful research has been done on this topic, showing us that certainly cats that have ongoing idiopathic cystitis problems have abnormalities in their sympathetic nervous system. They have an exaggerated sympathetic nervous system response. Their endocrine response is blunted, and they have bladder abnormalities. So there's certainly abnormalities inherent in the cat itself for both obesity and lower urinary tract disease. And what about the role of diet? Well, you're going to hear some things this morning about the role of food in treating obesity and lower urinary tract disease. So I won't talk so much about that, but I think about prescribing a diet. I think somebody said this yesterday, diet should be prescribed, right? So it should be specific recommendations, and I believe it doesn't have to be one, that you need to often provide choices for owners, and that there should be a dose and there should be a house. So, if a pet has an infection, you don't say, go get an antibiotic, Mrs. Smith. Like, pick one that's good for skin disease, whatever you like. But don't we do that for nutrition? We do that for nutrition. So I think it should be specific. And one of the things I was really happy to see, I heard Dr. Wachschlag say this yesterday, talking about measuring cups. So I loved his comment. How many of you use measuring cups in your practice? Yeah. So you send owners home with those. Go home and stop doing that. That's your enemy. Measuring cups are your enemy. I swear they're inaccurate. They are inaccurate. Even owners who want to be compliant can't be compliant with measuring cups. Alex German did a nice study in the UK showing that 80% of owners overfeed their dogs when they use measuring cups, even if they're trying to be compliant. So I'm on a mission to get rid of measuring cups. Owners should be taught to dose food by weight, not volume. Inexpensive kitchen scale. Dose food by weight. All of the feeding guides give you calories by weight. So for us in our practice, that was probably one of the key things we did that increased the success of weight loss programs for us. Getting rid of food cups, dosing by weight. So there's a take-home tip for you. But we'll talk a little bit more in just a minute about how cats are fed as well. So if we try to think about all of these moving pieces, we've got perhaps a susceptible cat. We have environmental issues. We have nutritional issues. Well, I can't change the cat, until genetic engineering comes along, I guess, or the cat is who he is. Really can't change that. So what do you and I have control over, the owner has control over? It's certainly over the environment, and it's certainly over the nutritional aspect of this disease, both of these diseases. So this is where we can spend our time and our efforts in working with owners. Now, there's some wonderful guidelines out from the International Society for Feline Medicine and the American Association of Feline Practitioners on environmental enrichment for cats. These are available for free at both the International Cat Care and the AFP website. So if you've not seen these yet, please go have a look. They're a free download. Even if you're not a member of either of these organizations, they're still available to you for free. They also include materials for working with owners on environmental enrichment for cats. So please look at those if you haven't already seen them. And they talk about things like giving cats enough resources. Most owners think that means food, water, and litter. But it also means places to spend some alone time. Here's Loki in India, two of my patients. Their owner sent me this photo. India is actually a black cat up in the tent there. Black cats are really hard to photograph, right? So trust me, India is in the tent. They are bonded cats. They love each other. Even bonded cats need to spend half or more of their day out of sight of each other. It's the cat way to be. And so that's one of the resources that we talk to owners about. This is a colleague of mine who sent me a photo of her cat playing with an iPad app. Right? This is a high-tech conference, so I thought I'd show you a high-tech cat toy. Kitty playing with an iPad app. So when we're talking environmental enrichment, it's very appropriate for both obesity and for lower urinary tract disease. Lots that we can do there to help owners understand. Remember that there's an outdoor world as well. This is a great photo that my friend Dr. Darcy Shaw, who teaches at the Atlantic Province's Vet College, sent me. He caught his cat one morning sitting in the window and looking at Mr. Red Fox looking in there. So the world is, even for indoor cats, the outdoor world also plays a role. And his kitties didn't seem too bothered by having Mr. Fox look at them. But if that was another, a tomcat in the neighborhood spraying on the window or staring at his cats, then certainly it might have made a big difference to them. So the outdoor world matters. Litter boxes matter. Litter box management. Ask owners to send you photos. There's another big tip for you. So here's the thing. This owner said to me, I have 2 litter boxes and they're in the bathroom. They didn't say, I have a litter box condo. And I'm just saying, if you were going to do that, wouldn't you put the bigger one on the bottom? I'm just saying, really, wouldn't you have done that? Right? And if you just ask them where are the litter boxes and how many, you get 2 and they're in the bathroom. You get a photo, you get that, okay? This owner says, I have 3 litter boxes and they're in the basement. How many litter boxes is that? That's 1. That's 1, okay? So ask for photos. Here's a litter box, laundry room next to a washer and dryer. Kitty's in the litter box reading the newspaper, having his little alone time. Dryer, kicks on or the washer goes into the spin cycle, scares the bejesus out of him. Confession number 3, that was my house. I've done it all, folks. I know it all firsthand. Get photos. Get photos. Really makes a difference. Okay, so here's Snoop. Snoop's one of my patients. Snoop is fat, and Snoop has idiopathic cystitis. So how are we going to tie her treatment strategies together? Well, certainly nutritionally, again, I'm going to leave the specifics to our other speakers this morning. But one of my challenges for these patients is that, I don't know about you, but I see cats with concurrent diseases. I go to conferences and you sit in lectures and somebody talks about diabetes as if their patients only get diabetes. They never come with like diabetes and kidney disease or diabetes and IBD. My patients go, I saw on the news, it's on sale at Walmart. I'm going to go buy IBD. Why not? Let's get another disease today. I feel like adding a disease. My patients have concurrent diseases. And so sometimes we are forced to make choices, treatment-wise, certainly nutrition-wise, to prioritize one disease over another. And I'm glad to see that climate changing, where we're starting now to get therapeutic diets that address the reality, and that is that patients come with concurrent diseases. So you'll hear more about that this morning. Certainly one of the challenges has been that diets for lower urinary tract disease have generally been higher in calories than we would like. So this is Tony, Smokey, and Carbon, 3 of my patients. Here they are all eating together. They're young cats. They're healthy. Their owner sent me this picture, fairly tolerant of eating together like that. But that's not the cat way to eat. If you're a cat and you go into a restaurant, provided they let you in, you would order a table for 1. Cats would order a table for 1. You and I are social eaters. We like to eat together. Cats hunt individually. They want to eat individually. And when they're young, they're tolerant of that. But when they get older or they have a disease and we need to feed them separately, owners tend to think it's cruel to feed their cat individually. So I build a lot of education around not just what to feed, but how to feed. And we teach owners this from the get-go when they have new kitties. And a lot of this, too, is about using interactive food toys. Good for obesity, good for environmental enrichment, good for stress reduction. So here's my other goal in life. It's not just to get rid of measuring cups, it's to get rid of food bowls. No more food bowls, okay? I call this the no free lunch program. That's what I say to owners. Your cat is going to earn every calorie from now on. Earn every calorie, no free lunch. So we teach owners of new cats, young cats, to start working with food puzzles, feeding toys, and with the goal of getting rid of the food bowl. Getting rid of the food bowl. If we can prevent obesity by teaching owners to feed cats correctly in the first place, I think will go a long way. So what about the role of water? Certainly, it's been identified as a risk factor for idiopathic cystitis, but we lack studies that say if you add water to a cat's diet, will it ameliorate their FIC signs? And I think we lack that data. But with obesity, there are some studies that suggest higher water intake is a satiety factor, as you might guess, and it does help with obesity. Certainly water fountains are environmental enrichment as well. So I wanted to finish this up with circling us back to the owner. These are some of my owners and their cats. And just to remind you again that the owner is the key part of this. I think the number one thing that our patients need, particularly patients with obesity and lower urinary tract disease, FIC in particular, is they need an educated owner. They need an informed owner, an owner who understands cats. And so my plea to you is to put as much time and effort into educating the owner about that little species that lives with them as much as you do about the disease the cat has. These two are intertwined in a way that we cannot separate. So thank you very much. I'm really appreciative of you listening to me talk about cats this morning. Thank you.
Thank you so much.
My pleasure.
Okay, wasn't she awesome? I need to hear a global roar for her. There she goes.
We have to do something. Hold this.
Okay, thank you.
So I'm glad that Dr. Garcia talked about selfies yesterday, because here's one of the things I do. I take a picture.
Exactly.
So smile, smile.
That's
okay?
it. Oh,
Turn it around. Hold on, let me turn it around.
Oh, there we go. Oh.
Hold on.
Oh, my God.
I'll get it.
She's a natural.
Here, okay.
Oh, there we go.
You ready?
All the way.
I know it's going.
Thank you.
Fine.
Cool.
Yay.
That's
okay,
it.
smile, everybody. Yay. Okay.
Excellent. Ooh, perfect. No, amazing. So, any questions? So, we have about 5 minutes for questions. So, we have the runners. Omar. Oh, 2. Excellent.
I feel very
First,
Madonna up
Omar,
here.
go
I've
ahead.
got like the lights and the
Hi,
Okay.
quick question. You mentioned dental disease.
Right there.
Where are you?
Right here.
Yay. Hi.
Hi.
I mentioned dental disease. Yeah.
Yeah, and obesity. Can you discuss the pathophysiology on that? I've
Yeah,
never
so
heard
I
of
don't
it.
know. Like, that's epidemiologically linked. So when you see those risk factors on that slide with obesity, it doesn't mean they're all cause and effect. They may simply be epidemiologically linked. The one way that they may be potentially cause and effect linked is we know that obesity does cause some degree of change in immunologic status. Certainly if you get diabetes mellitus, you have some immunosuppression. We heard yesterday that we don't know enough yet about the effects of obesity on inflammatory disease and immune function in cats, let alone dogs. And so my guess is there could potentially be a link there, but at the moment, I don't think we know exactly what that is beyond epidemiology.
All right, and I just had one question. Or Ellen, did you pay this person to ask this question?
What's the question?
Excellent. All right. Ellen has been complaining that there's no dental here.
Ah,
and so here
okay.
she is. We did that for her.
Okay.
Great. Thank you. Next question. There was one question right there.
Yes, as far as food enrichment toys go, do you have specific recommendations for different brands of toys?
That's a good question. So here's my one tip to you. There's lots of food enrichment toys on the market, but here's the one important thing. Start with something easy. Because if you start with something difficult, the owner gets frustrated and the cat gets frustrated. If it's a kitten, they can start with something a little bit harder. But if it's an adult cat and you're moving them onto an interactive toy, start with something easy. I'll get owners to take like an egg carton or a muffin tin and just put dry food in the wells, because it's easy for the cat to get it out. Owners need immediate payback, right? They need to see immediately that has worked. So I get almost all of them to start with something simple at home, and then we'll move them on, and then they'll be empowered, there's a good word, right? And they'll be enthusiastic, and they'll go out and they'll start buying feeding toys. Start producing feeding toys for cats with like Hill's logo on them.
All right.
And start producing scales.
Okay, corner
Where's the
there.
marketing
Take
people?
notes, please.
I got
Everybody.
ideas.
Okay.
Marketing
yeah,
people, I
Drew
got
has
ideas.
it. Drew's right on top of
Yeah.
it. Okay, Drew,
I have
you're
ideas.
rocking.
Okay.
We have a question right here.
Hi. Do you have any go-to statements or tips? I get a lot of times I go in the room and it's an obese cat, and I always get from the owners, but he really doesn't eat that much.
Yeah.
Yeah.
So here's the thing. The fatter cats get, when you get those cats whose body condition score is 49 out of 9, right? We all see them, right? They actually need even less calories than your average overweight cat to maintain that condition, right? I swear they add weight on air. I swear when they breathe, they add an ounce, you know. So to some degree, they might be right. On the other hand, I will tell you that most owners actually don't know how much their cat eats. They have a rough idea how much they feed, but they don't know what the cat eats. So my first step with those owners is let's find out how much your cat actually eats. And I teach them for a week, if we can do it, for a few days if not. Weigh the food bowl in the morning, weigh the food bowl at night for a couple of days in a row, because most people feed dry food and they feed it free choice. And then we'll do some math and we'll figure out actually how many calories they're eating. And remember yesterday, we heard about how you have to be very good at getting a nutritional history, right? Because owners won't always volunteer. They do that for cats too. They don't necessarily volunteer what else they're feeding their cat. And so I've learned to ask very open-ended questions like, you know, so here's what I used to say. I used to say to an owner, do you give your cat treats? Okay. And I had no client that gave their cat treats. No client. Because it's an implied answer, right? They want to give the right answer. They want to please you, right? And if it's a yes or no answer, they're going to pick no. So I changed it, and now I say, what kind of treats does your cat like the best? And guess what? They all like Temptations. I'm here to tell you. Okay.
All right. Thank you so much, Susan. One more hand of applause.
Thank you.
Excellent job. Love you.
My pleasure.
All right.